It's not new news that pregnant women shouldn't take medications, but it's often tempting to maybe just take a little Tylenol. I mean, after all, it's advertised as being safe for children.
Sure, and it's something that the doctors use in the hospital according to the ads more than any other drug. So if it's good for hospitalized patients, must be good for pregnant women, right?
Well, Tylenol or acetaminophen can have many dangerous side effects, and we have much information on this on drsaputo.com. And now a new study shows that pregnant women who take it increase their risk for having a baby that'll develop ADHD.
Yeah, well, we learn the hard way in medicine, and we have a paradigm that is a very dangerous model, because what we do is we use drugs to try and solve problems. And we never know all the side effects of the drugs because we don't understand cell biochemistry enough.
It's kind of the way that we've been trained to think
It's
of
just
a
what you
pill
do.
for everything that feels wrong, or, you know.
Exactly.
So like if a pregnant woman has a fever or a headache or a toothache or a backache
Sure.
or a sore throat or
Sure.
whatever, she's often thinks, well, I'll just take a little Tylenol.
Right.
But what people often don't realize is that there are alternative things that people can take besides a drug that are very helpful that don't have the side effects.
Oh, there are a lot of approaches that we can use. I mean, things like acupuncture and homeopathy and things like chiropractic and body work, therapeutic touch. I mean, there's a lot of ways to work through helping people who have pain. But what we should be doing is looking for the cause. Why do people have this pain? Now, I know that pregnant women are carrying a big load and they tend to get a backache. But maybe what they should do is get off their feet or do something to help the alignment with their back using some chiropractic adjustments. Using a drug is not the first choice of a wise clinician or a wise person, because almost always these drugs have side effects, and we find out about them like with Tylenol 50 years later.
Okay, so there are other side effects than the ADHD, but before we talk about what maybe some of these other side effects are, how common is this for pregnant women to take Tylenol?
Oh, well, the risk goes up substantially. Actually, the risk is somewhere in the range of 5.5% for developing a kid who has ADD as it is, but it goes all the way up to about 7% if they're on Tylenol, which is about a 35% increase in the risk of developing ADD.
And with 54% of pregnant moms taking it, that's
Right.
a lot of children.
Well, you're looking at tens of thousands of kids, okay, that will develop this every year. So it's not like it seems like a small amount because the percentage is small, but when millions of women are pregnant, you're going to be seeing changes that are a big deal. And we already have too many kids being treated for what we call ADD or ADHD.
So let's talk about what some of the other side effects are besides the ADHD.
Right, we're looking at liver problems. If you take too much of it, you actually can wind up with a liver that needs a transplant, or it may kill you. And it only takes about 15 or 16 grams in a single dose one time to cause that to happen. And if anybody's thinking about suicide, pick something else, because that's a long, miserable death. And then there are things like losing your hearing, which happens not infrequently.
What?
That's right. No more Tylenol for you. And bleeds of different kinds that can be an issue. The Stevens-Johnson syndrome,
Where your skin falls off?
Yeah. A lot of blood changes that are not so good with your red count, white count, platelet count. And people get hives. There are a lot of side effects, and that's probably the tip of the iceberg, because who studies the side effects of medications? It certainly isn't the pharmaceutical industry.
And you know, too, many times pain can be caused by stress.
Oh, for sure.
So it's like pay attention to your physical symptoms and maybe take a rest or lie down for a while and put your feet up if you can.
Right. Well, we should be thinking about lifestyle as our most important medicine, because if we do that, the chances of developing something where we have pain or we get sick is lowered immensely. So things like diet, exercise, stress reduction, sleep, weighing what you should, and having a purpose in your life that brings you joy are the things that keep you well, and there's nothing as powerful as that. So those are the things we should be looking at. So when we're thinking of what do we do when we have pain, the first reflex should not be, what pill can I take? I mean, even Darvon was on the market for about 50 years, and a couple of years ago was taken off the market because they found out it killed people too often from cardiac rhythm disturbances.
And Tylenol's been over the counter since 1950.
Right. So the first choice should be lifestyle. Then if it doesn't work, non-invasive therapies like chiropractic and acupuncture, etc. If that doesn't work, then think about a Tylenol.